Hello, everybody. Today we have with us Terri. Terri, can you please introduce yourself?
Hi, yes, I am Dr. Terri Roberston Elder, but I go by Terri, and I am a pelvic health physical therapist. I live in Brevard, North Carolina, which is just outside of Asheville. If you haven't heard of it, it's a pretty small town, though it is known as the summer camp capital. And I have a small private practice here focusing in pelvic health. Um, as well as orthopedics and oncology. So I like a lot of different stuff. And then I dabble in a lot of other things. I'm a part-time instructor at Georgia State University and get into a lot of fun, fitness stuff. And yeah, that's
Yeah,
basically professionally.
super cool. There is a lot of skill set there, but it's gonna be tempting to like ask you questions about everything, but I'm gonna try to stay with what we decided. So
Okay.
thank you for speaking about prolapse because um, that's a topic is where I feel like the more we talk about it, the better it is because there's just lack of resources. So I want to start from a perspective of what is prolapse?
Sure, sure. Well, can I share a little bit about actually my personal story with prolapse?
Sure. Yes, please.
And then I'll get into, well, what is it? So I actually was diagnosed with a grade 1 to 2, sometimes it's hard to tell, prolapse after I had my son. And I was new in the specialty. I had been a physical therapist for some years, but I was new in the specialty of pelvic health. And I had accessed pelvic health therapy just for some dyspareunia, and I just wanted to get like checked out postnatally and had no inkling that, anyway, she basically told me I had a prolapse. I was given a handout with restrictions, which included things like, no jumping, no lifting more than 15 pounds, no squatting with your hips below your knee. If you want to do that, you need to like go down on one knee. All these very rigid and restrictive guidelines. And I just remember leaving that and just wanting to cry because I'm like, okay, I love fitness. I want to jump, I want to run, I want to lift, I don't want to have to think about, not being able to squat down to get something out of a low cabinet or whatever, thinking that, my organs are going to fall out.
Yeah.
And so, I started doing some of my own digging around on the internet and social media. And of course, even with, clinicians, this is what we do, right? We go to social media, we go to the internet. Anyway, I found this one amazing Instagram account called Pop-Up.
Mm-hmm.
And they completely changed the way I thought about prolapse, about what I can do with my body, with the restrictions that I had been given were really not based in science and based in, anyway, we'll get into a lot more of that. So the story goes on. I did go to a urogynecologist to be assessed for a pessary, which I can talk a little bit more about pessaries later. And she said, you don't have a prolapse. We bear down in all these positions, and she's got a mirror out, and I'm looking, and there's no prolapse there. So I don't know if did it reduce? Did and that's something that I would like to talk about more as well, is sometimes these things that look like pelvic organ descent are really within the realm of what's normal and expected following a delivery. So was I given this diagnosis when I really didn't need to have this diagnosis? So fast forward 2 years later, I was doing my monthly self-check, which I highly recommend people do. Check the breast, check, your vulvar, or even if you don't have a vulva for men, checking all your tissues is a really great thing to do once a month. So there I am looking with a mirror and I'm like, well, there's something different. Okay. Oh crap. This looks like some initially I had an anterior wall descent, which is called a cystocele. This time it looked like there was some posterior wall stuff happening. And even with all that I knew and going on and really learning a lot more about prolapse, I still went through kind of the phases of questioning and what have I done? Did I do this to myself? What, and questioning. And so it was interesting that even from, from a professional standpoint, I know that there's not one single thing that you do that you can pinpoint to, say that that caused it. But I still, question myself and question me, myself professionally. But as it turns out, once I went again to a different urogynecologist. I'm in a different area, and we found that I actually have a levator ani muscle injury that we didn't know about, which is fine. It's not, I know that it's there now. It's not really affecting me or impacting me. Anyway, I got so much more interested in prolapse and pop that I decided to go through and do the Pop-Up Pro course, which is an amazing course that was really kind of focuses in, and it's given me a lot of insight. And I'm just so excited to share with your listeners some of the information and resources that I found, because it's really helped me understand it better. And of course, with understanding comes less fear, more empowerment, and just knowing that you can do what you want with your body. So that's my story, kind of in a nutshell.
Yeah, thank you for sharing that, because I feel like most people go through those phases of what to fear, to like what can I do, to feeling like it's all over life as I know, to then hopefully finally finding a balance, right? So just to kind of get all of those who have never heard the word prolapse, how would you describe prolapse, or what is it?
Sure. In a nutshell, it is your pelvic organs descending from where they physiologically used to be, basically. Well, there are a lot of different types. So technically, pelvic organ prolapse is different organs that may bulge into the vagina. So rectal prolapse is something that's different. It's the actual rectum prolapsing. So that can happen in men, but typically pelvic organ prolapse is something related to, or much more common in women and people with vulvas and vaginas. So the actual definition of it from the International Urogynecology Association is, quote, a departure from normal sensation, structure, or function experienced by the woman in reference to the position of her pelvic organs. So the actual definition is pretty hazy. It could just be the sensation, it could be the actual structure, and it could be something functionally. So there are a lot of different, professional associations that define it a little bit differently. For some, they say that you have to, that pelvic organ descent needs to actually be symptomatic for it to be considered prolapse. For some, they don't necessarily, and these symptoms can be vaginal heaviness, bulging, the sensation of bulging, things like that. Whereas some other professional associations say just the actual, like, physiologically, having the descent, even if you don't feel it, is. So it does depend on kind of like who's providing the definition. However, it's just in a nutshell, the organs descending and pressing into the vaginal wall. So there are
I'm guessing sort of like at a clinical level, you have people coming in when they feel something, usually a sense of pressure or heaviness or something else. So at what point, and I'm thinking more my new moms, do you have any insights on at what point should that concern them? Because when you've recently had a baby, everything feels heavy, everything feels like it's fallen apart, right?
Right, sure.
So, and we don't want to unnecessarily heighten that fear, because that's just what your body is doing to heal from a childbirth. But at the same time, sometimes women feel like if they had known to ask for help sooner, right? So could you talk a little bit about and what I have in mind is somebody who recently had a baby. At what point is this pelvic pressure something that you need to talk to a provider about?
Sure. I mean, that is really such a personal decision when to get help for something. Of course, for me, I'm biased. I would say go get help, but not everyone has access. But there are certainly a lot more therapists, physical therapists, and also other people in the pelvic health world who are doing, virtual consults now. So that is great for improving access for people who live in more rural and remote places. And, so if you're feeling pressure, if you're feeling that vaginal bulge, I would say, definitely get it checked out. Of course, as I mentioned, there is some, many consider that a grade 1 of pelvic organ descent postnatally is considered within normal limits of what you would expect, which to me, that's just like, so are some physical therapists pathologizing? Did that happen to me? Should I have given that handout, tell me to never, run and jump again? I think so. But
yeah. So, and also we don't know what was the situation before you had a baby, right? We always
right.
think that it's because of childbirth, and we also know that symptoms and the tissue don't necessarily match, right?
100%. And let's highlight and underline that there are a lot of people who have a lot of symptoms and they do not really show any pelvic organ descent. So that is something to think about. Even if you are feeling that pressure and bulge symptomatically, it may not be prolapse. It may be there can be a lot of other reasons for having those symptoms. And there are plenty of people who have a significant pelvic organ descent who are asymptomatic and fully functional, and
Yeah, and I think that's so powerful for people to hear you say that there are a lot of other reasons, because I feel like a new mom feeling pressure down there immediately Googles pressure in the vagina postpartum and you see like the worst prolapse image ever.
Mm-hmm.
And then that doesn't help the whole situation. So what comes across is the first emotion people feel is fear, so I wonder, like, why do you think that is? Why is the diagnosis of prolapse, and you and I both have seen this, countless women, right? Like whenever there's prolapse, there's just such an emotional piece attached to it. And I just want to see, like, why is that diagnosis having such an impact?
Sure. Well, I mean, as I said, when I received my diagnosis, it depends on the method of delivery. It depends on, of course, the person who's delivering this information. It depends on the beliefs that someone was bringing into it. I didn't really realize when I got my diagnosis, but I thought back to, my mom telling me about her friend who had prolapse and how she had to have surgery and she had to have mesh put in and it was just terrible and all these things that she said that I didn't even think about until all of these things came up and I was like, oh my gosh, that's gonna happen to me, and so yeah, fear of your body changing, as well as some body image changes, and all of it's kind of wrapped up and it's hard to say what's one and what's the other because there's so many changes postnatally. And then of course once you start Googling a prolapse, you can get a lot of scary information. So it can be very scary because there is so much different information out there. It's hard to know what to trust. And yeah.
Yeah,
So
and sometimes I feel like that fear even starts before childbirth, right? Like, so I wanted to talk a little bit about, like, sometimes there is do this to prevent prolapse, like, we don't necessarily understand what goes in. We know what can contribute to developing prolapse, but we don't necessarily understand it enough to prevent it, right? So
yeah,
can we talk a little bit about, like, prevention of prolapse?
Sure. So the well-known kind of risk factors in literature are increasing age, BMI or body mass index of greater than 25, having chronic asthma, chronic cough, having chronic constipation, a family history, which so there's possibly genetic links, connective tissue disorders, or having other, that the pelvic organ support and the connective tissue changes. And so having, varicose vein, hemorrhoids, or hernias, that may suggest that there's something going on connective tissue wise. A vaginal delivery, a first-time vaginal delivery is a risk factor, as well as use of forceps in a delivery. And then having had a levain or ani avulsion, which is an injury to the pelvic floor muscle. which typically happens, typically during vaginal delivery. So those are the risk factors. So basically, as far as prevention goes, there is no one single identifiable cause. It's always multifactorial. So there's, prevention really comes through trying to reduce those risk factors as much as possible. Some of them are, of course, non-modifiable. You can't help your age. You can't help your family.
You mean I can't change my genetics?
Yeah,
Come on.
exactly. But, are you chronically constipated? Are you coughing all the time? And, possibly there, possibly looking at some of the other risk factors, is particularly if you're going to have a second delivery, and we can talk about that a lot more. But then I did want to just point out that as far as exercise is concerned, there are no really clear and good studies that show that there is any kind of a risk with high impact or heavy exercise in the development of POP. So those with POP can run, jump, lift, and there are no safe and unsafe exercises. There's a lot more to how something is done. But, there's no current literature that shows either a positive or negative effect on pelvic floor.
Yeah, that's great to know, because a lot of times pregnant people are told not to do any kind of impact activities like jumping or running because they might develop prolapse. So there is no prolapse. People are already like creating the fear even before that, right? So,
well, I mean, there is, that's not to say that just because of this, if you're pregnant, you're there are a lot of other things that you need to take into account when looking at exercise with pregnancy, and looking at risk and versus reward and things like that. But you're right, as far as exercise, there's not a clear cause and effect with intense exercise and causing a prolapse.
Yeah. And so we talked about like fear of, delivery and fear of prolapse. Can we talk a little bit about somebody who's already been diagnosed with prolapse and is going into pregnancy and birth again? So I can imagine there is a heightened level of fear around it. So can we talk a little bit about that?
Yeah, absolutely. So, so I did mention, of course, that there is one of the risk factors for development of pelvic organ prolapse or POP is a vaginal delivery and use of forceps. And I did mention for the first delivery. So there is an association between first-time vaginal delivery, but studies are not as robust showing a correlation between subsequent vaginal deliveries and increasing severity. So that's good to know, right?
Yeah.
Doesn't mean that if you're gonna get pregnant again and have another vaginal delivery that if you already have prolapse it will worsen, or that you'll get prolapse again. There are not studies that show that directly. It still could happen, of course, but there are definitely certain things, and to look at when deciding on a second pregnancy, or you're already pregnant and deciding on your birth preferences. So definitely seeking out someone who's evidence-based, who can help you navigate, and then understanding, of course, that those are all very personal decisions. But as far as, there's a lot of different things to look at, right? So there is whether or not, first of all, to even try to have a vaginal delivery, or should I just go ahead and do an elective C-section? And again, completely personal, and I support, it's people's choice as to what they decide. But we know that there are risks with cesareans. That's it's another surgery. There are some risks even of developing prolapse following a cesarean, so it doesn't completely it's not completely preventive.
Yeah.
But there definitely are some other things if you do elect to have or to try for a vaginal delivery, that you could possibly go ahead and create some birth preferences written out that you may take with you, such as like something written out saying like, I do not want forceps used. And then the other thing to possibly consider is the length of the second stage of labor. So there is definitely a correlation with a longer second stage and a pelvic floor muscle injury, which we know that pelvic floor muscle injury is one of the risk factors for prolapse. So it's kind of a chain link there. But so that's the second stage. That's the pushing stage. So for multiparous women or women who have already had one delivery, long second stage is defined as without an epidural, anything longer than an hour, and with an epidural, anything longer than 2 hours. So that, and it's basically the pressure of the baby's head kind of on those tissues, which can create some, I don't want to get too nerdy, but that's what can create the injury. So, you could consider in writing out your birth preferences that, you may decide to discontinue laboring after a certain period or something like that. And sometimes, we know that these birth preferences are just preferences, right? It's not, that's why we call it preferences, right? And not a birth plan anymore, because, we never know what's going to happen, right?
Yeah.
But having these things, making these decisions, looking at another thing is pushing method, spontaneous versus coached pushing. And so there's some support for spontaneous pushing, meaning pushing only when your body kind of tells you, okay, it's go time, versus someone, like yelling at you like it's a drama on TV and going, okay, push, and that's something I wish I would have known in my deliveries. Listen to your body, and when it's time, let your uterus do its thing too, and actually help you and do the pushing. And you can give it some oomph if you need it. And then there are, a lot of other studies that have varying things that show, certain positions may maybe be better. No, sorry, that's the little one.
That's okay.
And certain positions may be better, as well as episiotomy versus no episiotomy. So, but the big ones are the ones that I mentioned, which is the use of forceps and the second stage of labor. So,
so now we're kind of on the other end, right? Like if somebody's already with a diagnosis of prolapse, we were currently talking about labor and delivery. I wanted the audience to kind of know of why physical therapy. How can physical therapy help, and can it help, and when can it help?
Yeah, so physical therapy can help with management of symptoms. So as far as, reducing prolapse, it can sometimes happen, but it's certainly not the goal of therapy. The goal is management of symptoms, getting you back to doing everything that you want to be able to do with your body. And, as far as preventing, we can't necessarily, like we said, we don't know single identifiable causes, but pelvic PT can definitely help improve pelvic floor function, work on addressing constipation, which was a big risk factor, looking at the pressure strategies for, especially if you want to do some of the higher level athletic stuff and do some heavier lifting, what kind of pressure strategies you're using, breathing strategies. We can, help, depending on where you are in the world. Some PTs can do pessary fittings, others can recommend pessary fittings. And a pessary is basically a device that is worn intravaginally that helps support those organs. Some people wear them 24 hours a day. Some people put them in only for certain activities. But they're a really great option for people who are experiencing organ descent, symptomatic organ descent. So lots of things that pelvic health therapists can do. And, I certainly recommend, asking your pelvic health therapist a lot of questions, and, you know, if there's a lot of fear-based messaging, finding finding someone who can support what it is that you want to do with your body, and you know, looking at pelvic health practitioners who've done specific you know, pop courses can be helpful too, such as the Pop-Up Pro and some of the other prolapse courses. Yeah.
Yeah. So it seems like physical therapy essentially will help you kind of understand your symptoms better and give you tools to manage the symptoms, right?
Yes.
And going off of that fear-based messaging that sometimes can happen as a PT, I feel like sometimes you don't know enough to let somebody do something. So I feel like some of the messaging might be coming from lack of knowledge. So thank you for sharing those resources. I wanted to kind of flip this around to I think everybody with prolapse already gets told what are the risks involved of exercising, right? I
Mhm.
wanted to talk about what are the benefits of exercising, right? Because yes, we're thinking about a vagina that is feeling a prolapse, but there's also a heart that is attached to this human body, right? Like, so general
Yeah,
cardiovascular fitness, general strengthening, and mental sanity, because for some people exercise is the antidepressant, right? So
of
can we
course.
talk about what are the benefits of exercising even with prolapse?
Sure. Well, you know, as one of our co-mentors who connected us would say, you know, restricting activity in the hopes of saving a vagina is not promoting holistic women's health, right? We are more than just our pelvic floors. Okay. And knowing that intense exercise and any kind of exercise that you want to do is not necessarily a risk factor for prolapse, I hope does give you some freedom. Um, and, you know, knowing that all the benefits of exercise greatly outweigh any potential risk. And you already mentioned a few, right? The mental health aspects, the, you know, bone density as we age, particularly for menopausal and postmenopausal women, you know, um, maintaining you know, our mobility and our strength to, you know, to be able to do with what, you know, what we want to do to love our families and just move around in the world. Of course, cardiovascular. I mean, there's so many benefits. So yeah, I think they're it's well established what the benefits of exercise.
Yeah, just generally the benefits of exercise. And also, I think often we forget that all the big muscle groups that we use in these exercises feed into the fascia that is, one of the things resulting in the symptoms. So often people who are stronger tend to feel less symptoms, just generally stronger, not like sitting there doing Kegels, but generally the stronger you are, you tend to feel symptoms less, right? So
Right.
there's
Yeah.
that benefit too. So do you have any special motivational messages for my prolapse moms who are runners?
Ooh, that's a good one. And I actually, when I discovered the most recently the posterior wall changes that I had noticed, which may have been there and I just didn't notice them before. But anyway, I went out for a run because I was like, I've got to run. This is and this is what we, you know, what we you know, need to do again for our mental health, for our sanity. So there are certainly ways that you know, you can look at breathing strategies as well as positional strategies that can kind of reduce impact. And you know a lot about running too, and different ways that we can reduce impact with and I do want to, of course, highlight that high impact is not necessarily a bad thing, and it's not necessarily bad for people with prolapse. However, it may be that you notice that, you know, when running certain distances or on certain surfaces, you notice you're a little bit more symptomatic. So paying attention to what, you know, what those variables are, and then trying to kind of control them and manage them. And then playing around with different things like different types of shoes, maybe using more of a you know, landing on the closer to the mid foot or the ball of your foot when you run. And there's one other really great tip, which is trying to actually run faster, not speed, not get there faster, but take more little steps, meaning your feet are moving
Yes.
faster. So you're
Hmm.
taking shorter steps. And so one of the ways that I do that is I listen to faster music, because I always want to move my feet to the, to the beat of the music. So
that's great. Yeah, I'm going to use that, using faster music, because then it's intuitively you just start to run faster, right? And I think I'm hoping most of my postpartum runners who are dealing with prolapse have heard that they can go back to the kind of running that they want to go back to. There's just so many variables to play around with. Yeah, and it'll take work, but you can get there, right?
Yeah, absolutely. It's about a gradually progressing, learning what's right for your body. Again, there's no absolutely safe or unsafe. It's all in how you do things, gradually building up adaptation within the body, so that you can do, what it is you want to do.
Yeah, and now I want to show some love to my postpartum CrossFitters. I particularly wanted your, views on like CrossFit and weightlifting with a diagnosis of prolapse, do's, don'ts, how, some resources, something.
Sure. So, I will say I'm not, I don't identify as a CrossFitter, um, but I love lifting heavy weights and doing, pull-ups and a lot of the movements that are used in CrossFit. So, I think I'm maybe a closet CrossFitter or something. I don't know.
That's a term.
I'm just not, I just don't go to a box, even though I know the term box, but
I think you'll fit in. You have the language. You'll usually fit in.
Yeah, I think I would love it if I can carve out that time for myself. But right now I'm doing a lot of street parking, which was started by 2 CrossFitters, and so I'm working out in my garage, and they have a lot of amazing resources for postpartum mamas, and lots of progressions and ways to build things up and modify. I absolutely love it. So a little shout out to street parking. So as far as doing some of these, these types of movements, a lot of it is, somewhat, heavier weight. It does kind of push the boundaries sometimes of what, women are told that they can do in gyms, which I love, because we can lift heavier weights and, we're not going to get bulky. Like like we were told back in, Jane Fonda days. So you, as far as, managing prolapse with these, again, I would just, seek out either a pregnancy and postpartum athleticism coach, or someone who knows about managing prolapse and managing symptoms with incorporating these activities that you want. With anything, it's like I said, progressing gradually, building up, learning what your strategies are, learning if you do tend to kind of bear down with some of these heavier movements, how to kind of change your breath and change your posture and change your position so that you can, minimize kind of the pressure down on the pelvic floor when you're lifting some of these heavier weights, or doing box jumps, or doing, pull-ups, or whatever movement it is that you want to be doing. So there are, and CrossFit coaches out there as well who there's a lot more who are, also pregnancy and postpartum athleticism coaches, or other people who have, advanced training in working with people. So I would certainly seek out some of those resources as well.
Yeah, so it's good to know that it can be managed and they can go back to the sport that they, that they really love. And if you're not finding the support, that's because you're not with the right people. Keep looking. There are more resources,
Yeah,
it's good to know that it can be managed. But now I want to kind of go a step further as to, does it ever get better? Am I managing this for the rest of my life? Like, what's the trajectory? Like, does it resolve? Because most of the times, the $1,000,000 questions, patients will ask, will this go back? Will this ever go back? So like, can we talk about like, what are we talking about in terms of trajectory?
Sure. So there are, some people do experience a reduction in grade. And as I mentioned, particularly if you're grade 1 to grade 2, which is I didn't really go into defining it, but there's essentially grade 1 and grade 2 is when the organ descent is still above the level of the hymen or the vaginal opening. And those are closer to kind of what are typical changes following a vaginal delivery. And those can sometimes reduce a grade. And again, like we mentioned, sometimes people are symptomatic when there's no physiological organ descent. So the grades 3 and 4 of prolapse, which is where the organ has pressed into the vagina and it has kind of descended beyond the level of the hymen, those don't have as much evidence to show that they typically reduce. However, they can still be managed with pelvic health therapy, pessary support, and people can still, live full lives, do what they want to do. There are certainly, when you get to later grade of, the grade 4, that's when some, may elect to seek surgical reduction of prolapse. And there are a lot of different aspects that go into that very personal decision making. And there are always risks to surgeries. These surgeries do tend to have a fairly high failure rate, very, very high compared to some other surgeries, about 30%. So even if people do choose to seek a surgical revision, it is still advised to seek, pelvic health therapy to help, again, mitigate those other risk factors, help them learn about their bodies, learn about their strategies, because if they're continuing, to do the things that, kind of went into the development in the first place, a surgery may not,
Correct.
yeah.
Yeah, we may not be able to reverse all the things that went into it, right? The surgery typically will reverse the anatomy,
Right.
but not necessarily etiology, right?
Mhm.
So I think that's sort of what I had in mind, is to talk about what is prolapse, what goes into it, how to handle it through pregnancy, birth, and life, right? I just feel like this was a really good overview of what needs to happen, but I wanted to go into our next segment of, like, the quick answers, where
Okay.
it's more like one thing, what's the one thing, because these are some of the common questions I get, right?
Sure.
So what's the one thing you will tell to a person who's feeling scared because they have prolapse?
It's okay to feel scared. I'm not going to tell you to not feel your feelings, but I would say seek guidance and support. It is something that can be managed. It is something that once you kind of wrap your head around it, you really may not think about it all that much, and it may not really impact your life all that much. So seek guidance, seek support. There's a lot of it out there for you.
Yeah. What about a person who's feeling guilty for having prolapse? Because sometimes moms will like, only if I had not asked for this, this, and this, I could have prevented a
Oh,
prolapse, right?
I know, because like I shared earlier, I felt that way too, and I wanted to be transparent about that, because even as a pelvic health professional, we go through those feelings of guilt and did I do this to myself, and you're grappling with all of these things, and if only I had changed this or that. But the truth is, like I said, there's no single identifiable cause. So there's no reason to feel guilty. There's nothing that you did to cause it.
Yeah. What about a person who's scared of having more children because they have prolapse?
Yeah, so again, it's a terribly personal decision, and there's so many factors to help you decide. So I say just seek information from good resources. Evidence-based birth is a really great website, not fear-based, very very evidence-based, and there are ways, like I said, to navigate all the myriad of choices and create some birth preferences that can help, somewhat kind of protect you from furthering or worsening some symptoms. Yeah.
Yeah, I think those were the main feelings I get with prolapse, and I think our messaging is sort of so much along the same lines. I wonder why. But going back to it, I totally forgot to just address this one part of like gynecological health from prolapse standpoint of like prolapse and intimacy, because there's usually a lot that comes up, right?
Yeah,
And I'm talking about no pain. I'm not talking about pain. I'm just talking prolapse and sex.
sure.
People just have a lot of thing to navigate there, right? So anything to add to that?
Yeah, sure. So, I mean, I definitely, it's something that I've heard a lot, that things just feel different now. And it's hard to sort out if things are feeling different, you know, particularly because of pelvic organ descent or because of all the other changes that have gone on with your body. So it is hard to know what's what. However, you know, I can totally understand not feeling super sexy after having some of these diagnoses. I have been there. And also, if you are feeling sexy, well, then great. That's not weird either. Go for that, you know? So some of the other things that you can look at if things are, you know, feeling different, you're not loving the difference, you want things to, you know, to go back, you know, looking at hormonal changes, particularly if you're still breastfeeding, your vagina is essentially menopausal with its hormones. So there are, you know, a lot of different things that you can do, such as like topical estrogen, things like that, and looking at other tissue changes that may not be directly kind of prolapse related. And then, you know, addressing other pelvic floor, you know, issues that may be going on, because our pelvic floor muscles are so important for arousal, stimulation, climax. That is, you know, one of the big things. So if your muscles aren't really you know, working for you like you want them to be, it may be that you need to work on some relaxation, or some, you know, some strengthening, kind of depending on what's going on. And, you know, then other than that, trying out, sometimes, you know, things shift and change. So maybe trying out some different positions. You may find that different positions feel better or less symptomatic for you. And then the biggest thing, you know, with sex is not what is happening between our legs. It's what's happening between our ears. So addressing that mental health component is so important. And when you have all these body changes, particularly for, you know, if they are from, you know, having, you know, a baby, or even if your babies are old and they have their own babies, addressing the mental health part of it, and seeking care, seeking, you know, a counselor who may be a sex counselor, or someone else who is, you know, well versed in helping people with changes to their bodies, is really important if you want to, you know, improve your sex life.
Yeah, you're right. It's all here.
Yep.
Intimacy is all, you know, above the neck, if you will. And I think that's where a lot of us could really benefit from referrals to sex therapy, right? When people are having difficulty with intimacy. Well, I think that was, now that I think I'm done, I can think of like 3 more questions to ask. I'm going to ask the last one. I'm not going to keep going,
Okay.
promise.
That's okay.
Menstrual cup and prolapse.
Ooh,
Thoughts, fear, what are we talking about?
Okay, so there are a lot of different types of prolapse. There's like lots of different types of menstrual products now, right? Lots of different, there's like the disc and the cup. Some people do report anecdotally that they experience a worsening in symptoms when they go to remove the cup, trying to like break the suction. Some people do reason that because something is sucking down, that it could pull the organs down, but there is not evidence to show that yet. However, if it's something that worsens your symptoms and you don't want to use that product, then you don't use that product. Some people do find that a disc, which is just, it fits in a little bit differently. It doesn't suction around the cervix. It kind of sits up kind of behind the pubic bone, that is a little bit more comfortable, but really everyone's different with what they find comfortable. So just trying different things. I love using either a disc or a cup just on a heavy day, and then doubling that with the kind of the period panties, because I don't particularly love tampons. Tampons feel different to me now than they used to, and that's the other thing, is that Some people tampons feel weird. So it really just depends on, what feels right for your body. But there is no, again, there's no evidence to show that either a cup or a disc is unsafe for use with prolapse. It's really just more personal preference.
Yeah, that's great. I think it's almost like a lot of patients will say that the size of the tampon they use have to change, or the size of the cup or disc has to change. So it's sort of like pessary. Sometimes people after births have to have a different size of the pessary. So maybe there's just playing around with it, but it's good to hear and very reassuring to hear that that's not going to make prolapse worse.
At least not yet. But if you feel like it's making your symptoms worse, then that's what it is for you. And that's fine.
I feel like once you just start to question everything that is in that area, does it have potential to make it worse, right?
Yeah,
So
of course, there's a lot of fear, and there's a lot of, I find one thing in particular is a lot of guarding, because they feel like, oh, my organs are going to fall. And so they're gripping all the time. And they end up with these overactive pelvic floors, which is not great either for a lot of reasons. So, checking in with yourself throughout the day to relax, and oh gosh, I have to do it too. That is an important part as well.
Yeah, and sometimes that's what you're feeling. All that clenching and tightness is what the feeling that you feel down there might not just be the descended organ. It might just be all the tension that we are holding to kind of hold the organs in, right?
So ironic.
Yeah. All right, I promise I'm done. This is the end of
okay. Is there anything that you want to chime in? Anything else?
Oh, I just, as you know, I'm currently working on talking less and listening more. So, but thank you so much, Terri. I really am very grateful for taking the time. I will put into show notes your, Instagram handle and your website. Is there anything else that you want the audience to know? Is there any preferred contact way if they want to reach out to you?
If you put my contact info in there, I am fairly active on both Instagram and Facebook. You could direct message me there. You could email me or go to my website and message me through my website. I do have, I'm not sure when this podcast will come out, but I do have a workshop coming up in June, on June 5th. It is a pelvic floor and core for athletes strategies workshop. It's a virtual workshop, so it can be accessed anywhere. It's 2 hours on June 5th at 12 p.m. Eastern. So
cool. Thank you for sharing that.
Website.
Yeah. Thank you so much.
Absolutely.
All right, Terri. Thanks again. I love the little cameraman.
Yeah.
Yes. All right. Cool. Have a wonderful rest of the weekend.
Yeah. You too.
All right. Thank you, everybody. Peace and out.